coronavirus. Schools have now been advised to cancel all trips abroad, but they're staying open, unlike in many of our fellow European countries that have decided to close all schools. People with pre-existing health concerns have been told not to go on cruises. 19 people we now hear have now died with the virus. More than 590 confirmed cases across the country. Sarah Stewart-Brown is Professor of Public Health at the University of Warwick. Joins us this morning on BBC CWR. Sarah Stewart-Brown, good morning to you.
Good morning, Phil.
Thanks for joining us via FaceTime link this morning. The Prime Minister's advice yesterday, do you agree with it?
Yes, absolutely. But there's a bit that isn't being aired. There's quite a lot of science that isn't being aired, which is, I suppose, what the Prime Minister and the scientists were saying yesterday is we're all going to meet this virus and we're probably going to meet it several times over the next few months. And what isn't being said is that whether we get symptoms, whether we get ill at all, or how severe the illness is, how long it lasts, is to do with our immune response. And that's something that's to some extent under our control. And I think that message needs to be available to people.
And in terms of the advice given yesterday, that if you were to develop some of these symptoms, to self-isolate for a period of 7 days, certainly for the elderly, older people who are choosing, we're hearing this morning, choosing already to change their behaviours, maybe even restrict contact with other people. There are dangers in that as well, aren't there? Loneliness and effects on mental health and well-being.
Well, one of the most important things that changes our immune system is relationships with other people, and supportive relationships, particularly when you're ill, feeling cared for, feeling that people are going to look after you, going to help you, is something that boosts your immune system. And feeling that you're a pariah, that nobody wants to know you, that you're dangerous to other people, is going to depress it. So it is particularly important when people are self-isolating that they set in place things to keep in touch with other people. And that's any age. It's not just the elderly. And there are things, I mean, quite a lot of people nowadays do have ways of helping themselves calm down, regulate their stress, change the way they're feeling. So, you know, people go to yoga, practice yoga at home, people do Tai Chi, people are doing mindfulness. And these are things that are known to have an influence on the quality of the response of the immune system. And I don't think enough has been said is that if you know how to do this, do more.
Yes,
and
yes,
if
okay.
you haven't learned how to do it, you know,
Now's
it's
the
something, get practicing. Now is the time. And there's other things like the length of sleep, the quality of our sleep has an influence on that. And so making sure you don't cut your sleep and that you look at the sleep hygiene regulations and other things. There's lots of evidence about is community choirs and singing.
Professor Sarah Stewart-Brown, got to leave it there. Thanks very much indeed. Professor of Public Health at the University of Warwick. Want to move on because I want to try and